And good morning to each of you who'd like to begin.
Good morning, and I'm glad you're here. Today I am speaking on behalf of the membership of Physicians for a National Program, Western Washington, numbering several hundred.
And can you state your name for us, please?
Oh, sorry. Dr. Sherry Weinberg, a retired pediatrician. Our national organization has been focused for over 30 years on helping the U.S. join the rest of the wealthy nations in providing health coverage for all residents. Today's 5 bills before you won't get us there, but they make some baby steps forward and might provide significant relief for some of our state's residents who are currently suffering the most. Before discussing the individual bills, I have a little thing here about the original folks in Canada who gave their patent to the University of Toronto for the vast sum of $1. Anyway, in the century since, we have certainly lost the dedication to community that this gift embodied. Think about that. On this bill, 6087, insulin should be available to all who need it without any cost sharing. Limiting cost sharing to $100 a month is at least a start in that direction, and I believe is only intended to be an interim assistance. So we're in favor of that.
Dr. Weinberg, thank you very much. Thank you for that reminder today as well.
Thank you. My name is Marcia Stedman. I'm with Healthcare for All Washington, and we strongly support this bill. We are grateful for this opportunity to speak to you today. Thank you very much, Madam Chair and members of the committee. I would like to read a speech, a short statement from one person who is an expert on endocrinology, a world-renowned expert, and he cannot be here today to deliver this in person. He speaks to the importance of affordable insulin. His name is Dr. Earl Hirsch, and he is associated with a local university up the road, University of Washington. So this is from a statement that he wrote in 2016. He says, "I would suggest that insulin is not a concierge drug that should be used only by those who can afford it. Insulin, in my view, is a right, not a privilege. And although I have no problems with the newest and greatest insulins receiving whatever cost the market will bear, older insulins, yes, including the insulin analogs, ideally should be made available for all Americans at a reasonable cost. This concept may seem counterintuitive for many in the United States, and perhaps, for insulin anyway, would make us look more like our neighbors and our friends in Europe. But to those who detest the thought of having our government involved in the distribution of insulin, I would say that I detest more the pain, suffering, cost, and potential death from diabetic ketoacidosis resulting from patients' inability to afford insulin. Insulin should be readily available to all who need it." Thank you.
Thank you very much. Good morning, sir.
Hi, I'm Ronnie Shure. I'm a retired pharmacist who transitioned to justice, social healthcare justice advocacy with Healthcare for All Washington. I practiced pharmacy for almost 50 years. I spent my career serving underserved populations in public health, mental health, and substance abuse programs. And I even spent 10 years in King County Jail working as a pharmacist. And I learned that insulin is a high-risk drug, that injury can occur from even minor changes with the drug. And for pharmacists, we realize there can be errors in several steps of the process. We've learned to pay much closer attention to this drug than many others, and we've developed some best practices, but we're still running into these deaths, to these injuries. And when we see the cost of co-payments, we know that's a barrier that is decreasing the rational use of the drug, that correct use, and it really increases that risk for injury, and it's just not an acceptable risk. It's time to make a difference and limit those copayments for all. Thank you.
Thank you, Mr. Shure. Senator Rivers has a question.
Mr. Shure, before you go, I'm so happy that you're at the dais today because I have a question. So during your time as a pharmacist, when you were not serving your time in jail, how many times did you refer patients to the cost savings programs that are offered by the pharmaceutical companies?
Constantly. At Harborview, we even had an internal program to provide charity to cover those cost sharing. Yet there were people who refused to accept that charity, who really wouldn't follow through, and who took it upon themselves to either skip meals, which caused another problem with insulin dosage, and it was rampant. It was one of the hardest things in making sure that that people are getting the right amount of their medication, was the fact that they couldn't afford those co-payments.
So do you think that other pharmacists make these recommendations as well? Or do you think that was just your standard cause of procedure?
Well, I certainly refer to what happened in Harborview and the program we used to try to prompt that or promote that. But every pharmacy has that available. Physicians in our community, nurse practitioners have access to those programs. It's a little bit of red tape, and it's hard for patients to follow through and keep up on it. And it's creating what is really a black market of rebates, kickbacks from drug companies without a really comprehensive goal to really make it more reasonable and a part of the process rather than some kind of an exception.
Okay, thank you very much.
Thank you.
Senator Kaiser has a question.
Well, since we have both a doctor and a pharmacist at the table, is it correct? I have been told that in the United Kingdom or England, insulin is actually an over-the-counter drug. Have either of you heard that?
So there are countries that don't require that, but there are still patients that are followed by their primary care providers with close supervision, and the pharmacists in those countries are required to complete other information and to monitor that therapy closely.
Thank you.
Thank you to each of you for being here. Appreciate it very much. With that, we're going to move to our next panel. And